Hi, my name is Dr. Sanjay Sharma, a podiatric surgeon and a wound care specialist practicing in Bangalore. When we say podiatry, today it has been synonymous with diabetic foot. For many reasons, it's a right way to understand podiatry, but also there is more to podiatry than just the diabetic foot. Globally, every 20 seconds, a limb is lost due to diabetes. And in India, there are about 14 lakh major and minor amputations that happens every year due to diabetes, and almost about 1.4 lakh major amputations. When I say major, it would be below knee or above knee amputations that happen due to diabetes. 70% mortality rate is observed in people who get major amputations. This mortality rate is higher than the comprehensive cancer's mortality rate. The diabetic foot amputations mortality is just below the lung cancer mortality. And a person who has a diabetic foot ulcer, which is almost about 19% of the population who have diabetic peripheral neuropathy, has to spend almost about 1.3 to 1.5 lakhs for a single ulcer to heal, and it takes almost about 12 to 28 weeks for a single ulcer to heal. As I mentioned earlier, it is not just about diabetic foot. It's about anything and everything to do about the feet. You must be amazed to see that there are almost about 1/4 of the bones of the body, as I mentioned, the feet. And it's sad to say that podiatry as a specialty is not recognized by the population and by the government in India. Qualified podiatric specialists in India are lacking. We are only about 75 to 100 people who have completed podiatric specialization outside of India and have come back and started practicing here. Podiatry, if you're looking at, is huge. As I said, almost 40% of the population have some or the other foot condition, and with the large population of 1.3 billion in India, podiatric interventions became key. With the affordability increasing and also with the sporting community increasing, it could be runners or tennis players or badminton players, and sadly also the chronic conditions like arthritis and diabetes increasing, the need for podiatric interventions is pretty high in India. The evolution of podiatry in India is crucial to enhancing the foot health and the overall patient well-being. At FootSecure, we are trying to address the key challenges that the sector is facing and working on solving them with specialized solutions. It can be innovative technology, be regenerative medicines, or high-end diagnostic devices and therapeutic devices that we have been using. Clearly, an awareness has to be increased about podiatry and its implications on foot health amongst the clinicians and also amongst the patients and the public at large. With this awareness and people seeking right care at the right time, a lot of drastic outcomes due to diabetes, arthritis, or any other conditions, and getting back to sports early and also preventing injuries in terms of sports injuries can happen.